Miss Aisha and Mr. Irfan, to both of you, I have sad news to deliver that both of you guys are unfortunately caring for thalassemia.
What? Seriously? So, doctor, is there any solution that we can do?
I know this is hard for both of you, but you guys can watch this video to understand about thalassemia disease better.
Hi guys! So today I'm going to talk about thalassemia. So, thalassemia has existed for thousands of years, especially in a region where thalassemia was common. In 1925, Dr. Thomas Cooley discovered a severe type of anemia in children called thalassemia major. By the 1940s, scientists confirmed that it was a genetic blood disorder. From 1950s to 1970s, blood tests helped diagnose thalassemia and blood transfusion become the main treatment. But too many transfusions caused iron overload, leading to new iron-removing medicine in 1980s. By the 1990s, doctors could detect thalassemia in unborn babies. In the 2000s, new drugs made treatment easier. The 2010s brought hope with bone marrow transplant and gene therapy as a possible cures. In 2019, the first gene therapy for thalassemia was approved. Today, scientists are working on gene editing for a permanent cure.
In Malaysia, 4.5 to 5% of the population are reported to be thalassemia carriers, while 3 to 40% carry hemoglobin E. Among those affected, Malays make up the biggest portion, which is 62%, while Chinese and Kadazan Dusun each account for 13%. As of the Malaysian Thalassemia Registry 2020 report, total of 8,767 thalassemia patients were recorded, with 589 new cases registered that year. Since 2007, 9,641 patients have been registered, including 874 deceased individuals. The mortality rate among thalassemia patients showed a decline from 8 to 8.8 per thousand in 2018 and 2019 to 6.0 per thousand in 2020, indicating a positive trend. However, the mortality rate remained higher for transfusion-dependent thalassemia patients at 9.3 per thousand compared to 1.9 per thousand for non-transfusion-dependent thalassemia patients. These TDT patients has a higher mortality rate than NTDT due to its severity and requirements for regular blood transfusions. Meanwhile, NTDT patients experience a less severe condition and fewer complications. The majority of patients fall within the 5 to 24.9 age group, making up more than 50% of the cases. Females account for 51.15% of patients, which is 2.3 higher than males, which is 48.85%. Ethnically Malays form the largest group with 5,725 cases, followed by Chinese, 973 cases, and Kadazan Dusun, 947 cases. An additional 345 cases belong to unspecified ethnic group, including Orang Asli, Tais, Iban, Pribumi Sarawak, and others. In 2020, 30 new births of thalassemia were recorded. The most common diagnosis remains hemoglobin E beta thalassemia, followed by beta thalassemia major, hemoglobin H disease, and beta thalassemia intermedia.
Thalassemia can be caused by the abnormality and the mutation of the genes of hemoglobin production. This can be inherited by parents. If one of your parents is a thalassemia carrier, you can have a mild thalassemia with no symptoms. If both of your parents is a thalassemia carrier, you can have high chances to inherit a serious case of disease. Back to hemoglobin. Hemoglobin consists of 4 protein chains, which is 2 alpha hemoglobin and 2 beta hemoglobin. And this protein chain consists of genes that carry genetic information. If one of these genes are missing or defunctions, this will lead you to have thalassemia. Alpha hemoglobin consists of 4 genes, and each two genes come from each parent, while beta hemoglobin consists of two genes and each one come from each parent. There are two types of thalassemia. First is alpha thalassemia and second is beta thalassemia. Let's talk about alpha thalassemia first. For alpha thalassemia, there are four stages. The first stage is when one alpha genes are missing or defective. This will lead you to have no symptoms, and this condition is called as alpha thalassemia minima. And the second stage where two alpha genes are missing or defective, and this will lead you to have mild symptom of thalassemia, and this condition can be called as the alpha thalassemia minor. For the third stages, where three of alpha genes are missing or defective, and this will moderate to severe symptoms, and this can be called as hemoglobin H disease. And lastly, if all of the genes are defective or missing, this will usually result in death. A newborn may need lifelong blood transfusion, and this condition can be called as hydrocephalus with hemoglobin birth. For beta hemoglobin, there are two stages. The first stage is when one beta gene are missing or defective, and this will lead you to have mild symptoms of thalassemia, and this condition is called as the beta thalassemia minor. For the second stage, when two of beta genes are missing or defective, and this will lead you to moderate to severe symptoms, and this condition can be called as the beta thalassemia major or police anemia. For syndromes of thalassemia, there are several symptoms based on what thalassemia you have. If you're missing one alpha gene, two alpha gene, and one beta gene, you may have no symptoms or we call it as asymptomatic. Or you can also have a mild syndrome of anemia like fatigue. From mild to moderate symptoms, you can have osteoporosis, growth problem, and enlarged spleen. What is spleen? Spleen is the organ that has an important role in fighting infection. And for the severe symptoms, you can have a yellow and pale skin color, a dark color of urine, and irregular structure bone in your face.
You may not need treatment if you are a carrier or have alpha or beta thalassemia trait. However, if you have a more serious thalassemia type like hemoglobin H disease, beta thalassemia intermedia, or beta thalassemia major, you may need such treatment as blood transfusions, iron chelation therapy, and also blood and bone marrow transplant. So for the first treatment, it is blood transfusions. It is the main way to treat moderate to severe thalassemia. This treatment gives you healthy hemoglobin red blood cells. During a blood transfusions, a needle is used to insert an intravenous IV line into one of your blood vessels. The procedure usually takes around 1 to almost 4 hours, depending on how serious your conditions or symptoms is how frequent blood transfusion is needed. Specifically, a transfusion may be needed when your body is under stress, such as during an infection, pregnancy, or even surgery. Regular blood transfusions for approximately once per month may be needed for people who have beta thalassemia major. This treatment helps maintain healthy hemoglobin and red blood cell levels. The second way is iron chelation therapy. The hemoglobin in red blood cells is an iron-rich protein. Regular blood transfusion can cause iron overload, which can lead to potentially life-threatening complications. Therefore, to prevent this, doctors use this method for people who receive regular blood transfusions to remove excess iron from the body. Three medicines are used for iron chelation therapy. The first one is deferoxerox. It is actually a pill taken once a day. Side effects include skin rashes, nausea, and diarrhea. So for the second one is deferoprone, which is a pill that may be used if other treatment do not work. It can lower your white blood cell numbers, which can put you at risk for infections. So the last one would be deferoxamine, which is a liquid medicine that is given slowly under the skin, usually with a small portable pump used overnight. This therapy takes time and can be mildly painful. Side effects can include problems with vision and hearing. Last but not least is blood and bone marrow transplant. It is actually a hematopoietic stem cells transplant which works to replace blood-forming stem cells that are not working properly with a healthy donor cells. A stem cell transplant is the only treatment that can cure thalassemia. However, only few people who have severe thalassemia are able to find a good donor match and are a good fit for the procedure.
Thalassemia, as we all know, is a genetic blood disorder that affects hemoglobin production. While it cannot be prevented entirely, taking certain precautions can help manage the condition and reduce complications. One of the precautions for thalassemia is genetic counseling and prevention. If you have a family history of thalassemia, genetic testing before marriage or pregnancy can help assess the risk. Other than that, prenatal testing is also crucial to ensure that the baby carried by a woman is affected with thalassemia or not. Pregnant women can undergo tests like chorionic needle sampling or amniocentesis to check for thalassemia present in the blood of the baby. Marriage counseling, such as genetic counseling, is recommended before marriage among people to prevent passing the disorder to the children. Moreover, regular medical checkups can also detect our routine blood tests. This way, we can monitor hemoglobin levels and iron levels regularly with the doctor. Furthermore, frequent blood transfusions can cause iron overload, which lead to organ damage. Healthy diet and lifestyle can also be precaution of thalassemia. If the person has diagnosed with thalassemia, they need to get a balanced diet that includes vitamin D, calcium such foods, and folic acid for overall health. Patients also need to avoid excess iron since iron is a common substance found in blood red cell. Thalassemia person can also be aware with excessive exercise. This person need to take optimum amounts of exercise so that they won't be exhausted and fainted. For young thalassemia major patients, they should not burn out while exercising, but they can schedule their exercise activities according to how much exercise they can do.
Thank you for your explanation, doctor.
You're welcome. I hope both of you can make the best decision for your future.
Thank you.